Welcome back to AfyaWingu Patient Management. In this video, we'll walk you through Section 5, Assessments, where you'll document your clinical observations of the patient's current condition using standardized tools like general appearance, neurological status, AVPU, and ESI Triage Level. You're still viewing the record for Maxwell Wright, age 20 male, with visit date November 25, 2025. We've already documented his chief complaint, vital signs, history of present illness, and medical history and safety. Now it's time to capture your clinical assessment. At the top of the screen, you'll see the tabs again. We're now on 5, Assessments, which is highlighted in blue. Let's go field by field, with clear definitions and examples for each. Section E, Assessment, Focused Exam, and Acuity. This section helps you quickly communicate the patient's overall condition to doctors and other staff, using simple, universally understood terms. 1. General appearance. This dropdown lets you describe how the patient looks at first glance, based on their level of distress. Available options: well-appearing, mildly distressed, moderately distressed, severely distressed. When to use each: well-appearing. Patient is calm, comfortable, sitting upright, making eye contact, no obvious signs of pain or discomfort. Example: patient sitting comfortably, smiling, answering questions clearly. Mildly distressed. Patient shows mild signs of discomfort, may be restless, fidgeting, or slightly anxious. Example: complains of mild headache, rubbing temples, but able to talk normally. Moderately distressed. Patient is visibly uncomfortable, may be grimacing, breathing fast, or holding an area of pain. Example: clutching abdomen, moaning softly, moving slowly. Severely distressed. Patient is in extreme distress, may be crying, screaming, pale, sweating, or unable to sit still. Example: crying out in pain, clutching chest, breathing rapidly, pale and clammy. Tip: use this as your first impression, don't overthink it. Trust your gut and choose what matches best. 2. Neurological AVPU. This assesses the patient's level of consciousness using the AVPU scale, a quick, reliable tool used worldwide in emergency care. Available options: alert, response to voice, response to pain, unresponsive. When to use each: alert, patient is awake, aware, and responding appropriately to questions and surroundings. Example: patient opens eyes spontaneously, answers all questions correctly. Response to voice: patient does not respond unless spoken to, but wakes up and responds when you call their name. Example: doesn't open eyes until you say Maxwell, then answers yes/no questions. Response to pain: patient only responds to physical stimulation, like a pinch or sternal rub. Example: no response to voice, flinches when you pinch their shoulder. Unresponsive: patient does not respond to any stimuli, no eye opening, no verbal response, no movement. Example: no reaction to voice or pain, eyes closed, no movement. Tip: always test AVPU before giving any sedatives or starting procedures. It's a critical safety check. 3. Focused exam, conditional. This is a free text box for recording specific findings from your physical exam, especially if you noticed something important during triage. Example input: heart sounds, regular rhythm, no murmurs. Lungs, clear bilaterally, no wheezing. Abdomen, soft, non-distended, tender and epigastric region. Tip: only fill this if you performed a focused exam, otherwise leave blank. Keep it brief and factual. 4. Suggested ESI level. The system may suggest an Emergency Severity Index, ESI level, based on the data you've entered so far, from 1, most urgent, to 5, least urgent. What ESI levels mean: Level 1, immediate life-threatening, needs resuscitation now, e.g. cardiac arrest, severe trauma. Level 2, high risk, could deteriorate quickly, e.g. chest pain, stroke, severe bleeding. Level 3, stable but needs multiple resources, e.g. fracture, moderate abdominal pain. Level 4, stable, needs one resource, e.g. minor laceration, sprain. Level 5, non-urgent, needs minimal resources, e.g. prescription refill, routine checkup. The system suggests a level, but you can override it if needed. Number 5, assign final ESI. Click the number that matches your clinical judgment, or hover over each level to see its full description. Example: if Maxwell has fever, low SpO2, and is moderately distressed, you might assign ESI Level 2. Always confirm or adjust the suggested level based on your assessment. This determines how quickly the patient sees a doctor. 6. Assessment notes. Use this large text box to write down anything else important: your clinical impression, differential diagnosis, or plan. Example input: Young male with fever, low SpO2 and epigastric pain, possible pneumonia or GI infection. Recommend CXR and CBC. Monitor O2 saturation. Tip: write clearly and concisely. This note will be seen by the doctor and may guide treatment. 7 checkboxes: fall risk, fever, DNR, living will confirmed. These are quick flags to alert staff about special considerations. Fall risk: check if patient is unsteady, dizzy, elderly, or on medications that cause dizziness. Fever: check if temperature greater than 38 degrees Celsius, already flagged in LEV interpretation, but good to confirm here. DNR, living will confirmed. Check only if patient or family has confirmed a do not resuscitate order or advance directive. Tip: always ask, do you have a living will or DNR order? Especially for elderly or critically ill patients. Save your work. At the bottom left, click the blue Save Information button after entering each field, or at least after completing the whole section. The system auto-saves, but clicking Save ensures everything is recorded and visible to the next clinician. You'll also see last saved November 25, 2025, updated by Malaika Center. This helps track who entered what, important for accountability and continuity of care. And that's it for Section 5, Assessments. Once you've completed this, you're ready to move to Section 6, Administer medications, to prescribe or give drugs during triage. Each step builds a complete clinical picture, helping doctors make faster, more accurate decisions and keeping your patients safe. Thank you for using AfyaWingu, making assessments simple, structured, and clinically meaningful.